Hello, I'm Dr. David Klayman from BostDia, Bone Strength Diagnostics, and I'd like to welcome you today to our presentation on how to read a REMS report. The purpose of this presentation is to help you to get a better understanding of the information contained in a REMS report so that you and your healthcare providers can use the data to make better decisions pertaining to your overall health, your longevity, your bone strength, and your bone quality. This presentation is not intended to be used as medical advice. This presentation does not constitute a doctor-patient relationship, and the presentation is solely intended on providing information for you to better understand the information contained in your REMS reports. Now, I'd like to go over three definitions with you. These are things we're going to touch on throughout the discussion today. One is called osteopenia. Osteopenia is described as a state where a person has lower bone mass, bone strength, or bone density. Typically, the lower your bone strength, the higher the risk of fracture. Osteoporosis is a disease. This is a diagnosis where your bone density or the structure has significantly weakened to the level where you have an elevated risk of fracture. Osteoporosis is a diagnosis where osteopenia is a description. The third definition is a T-score, and we're going to talk about T-scores throughout the presentation today. A T-score is a number that is used to define a person's level where your bones are at, meaning are they normal in their bone density, are they in the osteopenia range, or are they in the osteoporosis level? A T-score is a product of your REMS scan as well as a combination of demographic information such as your age, your sex, your ethnicity, and your weight. We combine all of this data to put a score together called a T-score. Now, the World Health Organization utilizes T-scores to define if you are in the osteoporosis, osteopenia, or normal range. Normal bone density would be a T-score that is above a -1. Osteopenia is a T-score that is between the level of -1 and a -2.5, and osteoporosis is a T-score where you are at a level where your number is either at a -2.5 or below. Now, if you've got your REMS report in front of you, I'd like you to take a look at the one that pertains to your spine. On the first page of the report with your spine, you will see right in the middle of the page a item here that says T-score. Now, as we discussed, a T-score that is below -2.5 is considered osteoporosis. This person would have a T-score of a -3.2. Now, above that is a box that represents where you lie. Now, this person here, there's a circle in the lower right quadrant. The bottom line is the age. So this person is 73. That's why their dot is here. And their bone density T-score is at a -3.2, which puts them in the red range on this chart. Red indicates that you are in the osteoporosis range. Yellow would be the osteopenia range, and if it lands in the green range, that's good. That's the normal, healthier bone density. Now, on your right, you can see four boxes here. These represent four of your lower lumbar vertebrae. These are the bones in your lower back. They represent L1, L2, L3, and L4. Beneath the picture are the bone mineral density scores. These are what we call raw scores. And next to them are the T-scores of each of the individual vertebrae. Now, it's very important to know that in order for a REMS study to be valid in the spine, it requires that you have a minimum of 2 consecutive vertebrae that have been scanned and we have a T-score for. So you could have 2, 3, or 4 vertebrae as part of your study in the spine. The average of the score of either 2, 3, or 4 vertebrae is in the middle here, and that's what's called the overall T-score, and that's used for your overall diagnosis. Now, each vertebrae also, as you can see, has a color. If the vertebrae is red, it's in the osteoporosis range. If it was yellow, it would be in the osteopenia range, and green indicates that each of the vertebrae that are green are in the normal range. Now, underneath your T-score, it says fracture risk assessment. Beneath that is what's called a fragility score. And to better understand fragility scores, let's go to page 2. On the second page of your report, it breaks down what your fragility score is. The fragility score is representative of your bone quality. This is how well the bone is made, as well as what components are in your bone. Are they good, healthy minerals, cartilage, and are all of the materials that make up your bone good, or are they poor? The lower the fragility score, the better, meaning that the less fragile, the better for you. If you lie in the green range, that's good. If it lies in the yellow range, that means that there is decreased bone quality and it elevates your risk of fracture. If it is in the red range, that is a lower or a poor quality bone. Ideally, we want people in the green area, which is good. Now, this person has a fragility score of 50. Fragility scores are from 0 to 100, 0 being the best, 100 being the worst. This person is right in the middle in the yellow range, which means they have a lower bone density, a lower bone quality score. Now on page 3, this is one of the most important things about a REMS report. We have the ability with REMS to combine the T-score and your fragility score to allow you to know what risk class you are in. Let's define that here. On the top, there is a box that combines your osteoporosis, penia, or normal T-score with your fragility score. Now, this person, as you may remember, was in the osteoporosis range. So we would stick with this right side column, and we would look on the left where their fragility score was. Now, they had a yellow or decreased fragility score. If we go across where the fragility score meets the T-score, it gives you an R class or a risk class. This person is at an R5 or R6 level. And if we go underneath that and look at the box of what R6 means, it indicates that this person has a 6 to 10% chance of a fracture over the next 5 years. Now, the risk class puts you together with people who have a similar T-score, similar age, similar demographic, ethnicity, weight, and height. We group together people like you, and we look at what is the risk that you will, being in this group, have a fracture in the next 5 years in the spine. Now, on your next report, you either would have a right femur or left femur. Both of these reports are identical. We'll use this person's right femur to give you an example of what you're looking at. On page 1, very similar to the spine, you'll see a T-score right in the middle. This person has a T-score of a minus 1.2. You would look there first. Above it is the representation of where your T-score lies on the graph. This person has a red, yellow, and green box. They lie in the yellow range in the box, which means it's osteopenia. Green again is normal, red is osteoporosis. Now you also may be wondering, what are these wavy lines on the graph? These show the natural progression that the majority of people will follow throughout their lifetime. Unless you're doing something to increase or change the trajectory of your bone health, typically you lose 1 to 2% bone density per year. This person right now has a minus 1.2 T-score. If they follow the normal trajectory, as you see, it would go down as they age. Now, the other thing I'd like to point out is there's also what's called a Z score, whether it's the spine report or the femur. A Z score is comparing you to people like you, meaning that it compares you to people in a similar age, sex, and body type. A Z score is considered normal if it is above a minus 1.5. The higher, the better. If you're below 1.5, it's considered below normal for your peer group. So a better Z score is a higher number. Now on page 2, we have the fragility score, like the spine. This refers to, again, your bone quality, what makes up the interior, the inside of your bone. The bottom, again, is green on the graph. Green is good. Yellow is a lower bone quality. Red is the lowest or poorest quality of the bone. This person has a fragility score of 47. It places them in the yellow range, which means they have a lower bone quality than ideal, better than being in the red range, but not as good as being in the green range. On page 3, like we showed you before, we're combining the T-score and the fragility score. This person had an osteopenia T-score, so we would go down the line here from osteopenia. We would go across from the yellow fragility score that they had, and where the two yellows meet is right in the middle. This person has a risk score of R3 to R5 in their femur. Now, to remind you, the femur is the bone that runs from your knee up to your hip. The R3 score indicates that this person has a 0.4 to 0.8 chance of a fracture over the next 5 years. The better the R score is the lower number. So R1 would be the lowest risk of fracture. R7 would be the highest risk of fracture. When you know where your risk class is or your R score, you would then look to the right. It would tell you the percentage risk that you have for a fracture over the next 5 years. As you go through a REMS report, one of the most important things that I remind my patients is that when you're comparing REMS scores, meaning this year versus next year, or if you're comparing where you are now versus a year ago, you want to stick with the same technology, the same type of data. You want to compare a REMS scan report to a prior REMS scan report to accurately measure what changes are going on in your bone health. If you had a DEXA scan, you would compare that to a DEXA scan. You do not want to compare a DEXA scan to a REMS scan when you're measuring progress. The reason is that a T-score on a REMS scan may not match the T-score on a DEXA scan. Not only are they different technologies, but there are things that affect or skew the accuracy of a DEXA scan T-score that would have no effect on a REMS scan. For example, if you have arthritis, a scoliosis, or if you've had surgery of one type or another, it may skew the results of your DEXA scan, but it may not affect the T-score represented on a REMS report. So the reminder here is, for progress, compare a REMS to a REMS. And I also remind all of my patients that I work with that your REMS report, while it is vital information for the quality and the structure, the strength of your bones, and it's a very important piece of the puzzle, it's one of many pieces of the puzzle that makes up you and your health. When you're looking at the data and you're trying to figure out what should I do about my health and well-being, I remind you to utilize your REMS report, but also look at if you have prior x-rays or MRIs, if there is blood work, if you have any nutritional information as to the quality of the nutrition in your body. We would also recommend you look at the level of physical activity, what type of medications you may or may not be taking, if you have any medical conditions, and what type of lifestyle you have. For example, is it high stress or low stress? These are all pieces of the many parts that make up you. When I go over a REMS report with people, I also remind them that there is an opportunity that you have, which is an option to schedule a one-on-one bone health consultation with me, Dr. Klayman. This is optional, but what we do is we take an in-depth review of the factors in your life that may be affecting your bone health, your overall health, your longevity, your safety, and your quality of life. And we discuss the options that you have to ideally live a better quality life that you choose. When we do a one-to-one consultation, there are two parts. There is the pre-consultation review of information that you can forward to me. I take the time to go over any prior REMS or DEXA scan reports, any blood work you would like to submit. We look at MRIs or x-rays, usually of the spine, the hip, the femur. We look at your nutritional history, medication use, as well as medical conditions, and we look at lifestyle factors that may have an impact on your bone health and bone quality. We then schedule a 20-minute one-to-one virtual consultation to go over all of this data and answer any questions you may have. If this is something you're interested in, we do charge $75 for the one-to-one consultation, and you can let us know if you have an interest by sending an email to us at BostDia. Our email address is hello@bostdia.com. You can also submit any questions or feedback about this or any other part of our program. We do look forward to hearing from you, and we take your health and your feedback very seriously. Thank you very much for being part of today's presentation and discussion. I hope you gained a lot out of it, and good luck on your health and your overall longevity and well-being.